Okay, ladies, we are live.
All righty. Good afternoon. And we're praying that all of our Facebook friends on Live Healthy Miami Gardens is coming on in because it's our time for our Facebook Live here, our weekly segment that we come forth and we're giving health information that's brought to you by the city of Miami Gardens. And it is our Live Healthy Miami Gardens initiative. Our goal with this particular initiative is to bring information and resources that help make the healthiest choices possible for the residents who live, play, and work in Miami Gardens. And today I am Dr. Cheryl Coleman with Abundant Living Health and Wellness Resulting Services. I'm one of the Live Healthy Miami Gardens partners. And what we do at our facility is simply bring health education, life coaching that brings about healthy living on all 10 dimensions. We love and we specialize in working with our faith-based communities, helping to create world-class congregational care ministries. But it doesn't stop there. As a healthcare practitioner, we like to provide consulting services as well as implementing health projects and programs that promote healthy living. And that's how we're connected to Live Healthy Miami Gardens. Can you tell I'm excited? Yes, as a nurse practitioner with over 30 years of experience, I'm excited because I'm not alone on this blessed day. I'm your host, but I have another champion of health that's with us, and that's none other than Dr. Joyce Lawrence. She is the Chief Medical Officer of the Jesse Trice Community Health Center, and I'm going to pause in this moment to let her tell you a little bit more about herself, and then we're going to dive right into our topic on today. Dr. Lawrence?
Sure. Thank you so much for having me, and thank you so much for your enthusiasm for this important health topic that we'll talk about today. But I am the Chief Medical Officer for Jesse Trice. I've been with the organization for over 7 years. Prior to that, I was with the University of Miami in the Department of Family Medicine for just over 17 years. I am from Miami, so I love that area. It's dear and near to me, and I'm very happy to be able to serve a community that I grew up in.
Well, you know what? We're excited to have you. I've had the pleasure of being in meetings and settings with you, and we are grateful for the work that you are doing in our community. And so, with that said, we're going to dive into it because we know that you have an expertise that we need as we're looking at this month's topic around minority health. Yes, it's April and it is National Minority Health Month. And so, we thank God for this month and the focus on minority health. And so I guess as I share that, Dr. Lawrence, just want to hear your thoughts around minority health and what it entails, the equities and the inequities. If you can just break that down for us.
Sure. Well, let me start by saying that health equity actually is the achievement of the highest level of health for all people, where everyone has a fair and just or equal opportunity to attain the best health that they can have, regardless of their race, ethnicity, disability, sexual orientation, or any other factor that comes about. It means striving for the highest possible standard of health for all while giving special attention to those who are at the greatest risk for poor health.
Wow. And as we think about that, health equity is, the right health that we would all want to have. But those inequities that we are seeing, and you as a practitioner, what are some examples of inequity in health?
Sure. And I'll start with a simple scenario, one that people may have heard before. And an example that I can give is just having a tree with fruit on it. You have a tall person, a short person. The tall person can reach the fruit all day long. The short person needs some help. They need a ladder or something that will enable them to get to the fruit just as the tall person does. So when it comes to health, you can look at something simple as saying that we've got mammograms, they're available to everyone. The mammogram place that you need to be at is on the north end of town. However, the person may live on the south end of town. That person may not have something like transportation to be able to get to the mammogram. Or it could be something as saying we've got colonoscopies that are available for everyone. However, not everyone can afford to have a colonoscopy. So those are the types of health inequities that we need to address.
Yeah, and so when you speak about that, it's really also about the access, right? We can have all the right health and we can have those resources, but if people aren't able to access them, then that is uh, an inequity, right? And
Yes.
so, thank you so much, Dr. Lawrence, for breaking that down. And I know these words sound big for those of you who may not be in the healthcare profession. And so, our theme is better understanding of our health. And so, we're breaking down some of these terminologies for you so that you're able to understand them. Because when we can understand, knowledge is power. And when we have power, we can have the healthy bodies, the healthy lives, and the healthy journey that we all want to have. With that said, Dr. Lawrence, there's something else that's called healthcare disparities. Can you tell us about what a healthcare disparity is?
Sure. So, health disparities, those are preventable differences in the burden of disease, injury, or violence. Anything, any opportunity to achieve the best of health that might be experienced by socially disadvantaged, excuse me, by socially disadvantaged populations. So, healthcare disparity typically will refer to a difference between groups that might have to do with health insurance coverage, access to care, use of care, and even quality of care.
Yeah. So, with disparities, are there a specific population? Because you mentioned that is more disadvantaged than others.
Yes, definitely. Health disparities, they're a real and pressing issue, especially in the US. And these disparities can also exist when people experience a difference in their health and illness levels because of their race, ethnicity, income, or location. So we're talking about minorities, and
Mhm.
in particular, African Americans. And the things that we're talking about, the where we live, work, and play, those are referred commonly to as social determinants of health.
Wow. I know we're kind of breaking down and helping those who are watching now and those who will watch virtually later some of these terms, but you serve right in the community, right there in Miami Gardens, and those who come to seek out care. What are you finding there in the area in which you're serving as a leader?
Sure. So when you look at just things like chronic illnesses with hypertension and diabetes, Blacks are disproportionately affected by those things. And the disparities come into play when you start to look at things like diet. We don't always have the access to fresh produce, fruits and vegetables that other neighborhoods may have. So that's where that inequity, that's where those disparities come into play. Other things, when you look at cancer rates, Blacks suffer from higher rates of death in just about every kind of cancer there is, even though the incidence of cancer in Blacks may be lower. And that's because of those disparities, that where we may not have the insurance, can't afford it, might not be able to take the time off from work because you might lose pay if you take time off to go and get those studies done. Sometimes it has to do with stigma or just lack of awareness, but nevertheless, those are all disparities.
Wow. And I guess I'm grateful because I am also a Miami Gardens resident and here from Miami. And it's great that we will have the facility that actually serves those in Miami Gardens. So I don't know if there are specific disease processes. You kind of called out some of them, but we're grateful for the access that you all provide. Is there anything you want to highlight about Jesse Trice at this time to make sure that our community knows and have access, that we can get rid of some of those inequities and addressing those disparities?
Sure. And there are ways to go about addressing inequities and the disparities that cause those inequities. And a lot of it is a perfect example is what Live Healthy Miami Gardens does. In the beginning of your initiative, you went out, you did your needs assessment, you studied the community, you saw what was there, and then you developed ways in which to address those issues. Jesse Trice does exactly the same thing. When it comes to our diabetic and our hypertensive patients, we have programs that all of our patients can engage in, whether or not it's attending small group classes or being a part of our remote monitoring program. Especially in the beginning of COVID, we issued blood pressure devices and glucometers to our patients. These devices were Bluetooth enabled. So during COVID, if patients weren't able to make it in, they could actually transmit their readings in, and we could reach out to our patients via telehealth, either with the audio or just a telephone call, and be able to address their readings and get the prescriptions in and the types of treatment that they need.
That's awesome, because that was going to be my next thing that I was going to ask around COVID-19. Once COVID hit, our world changed as we knew it, and I'm sure for you as a physician and for me as a practitioner in health, I thought about studying and how they prepared us scientifically for things that had already occurred, and there's been some tried and true things that we can do. But when COVID hit, it was real time trying to figure out how to care for those patients, trying to get vaccination, whatever we needed to do to save lives. And so
Mhm.
we know that it wasn't easy. And so you touched a little bit on there, and I'm
Mhm.
grateful for that. But COVID and the pandemic really caused or affected these disparities. And I don't know if there's anything you might want to highlight more around that.
Sure. Other ways in which we have addressed that and continue to address, we do provide food drives. We realize that a lot of people had a loss of jobs, loss of income, and because of that, housing even became a problem. Being able to pay for food became a problem. So we did do the food drives. We also hosted a number of vaccination drives, and we're still providing vaccinations, by the way. Um, the other thing that we did, especially for patients that did suffer from COVID and were hospitalized, we actually offered what we call an integrated care approach, where that patient could access their team of providers within one visit. So it was the patient along with their primary care provider, but we invited the dental person in, we invited behavioral health in with social workers, case management, all there within one visit so that we could make sure that that patient left having everything they needed, especially since some had been in the hospital for so long.
Wow. And I think that that's powerful because in serving now outside, I did acute care in the hospitals for about 25 years, but now focusing in the community, which is where you serve. And that's I love all my acute care people, but in the community, that's where like some of the real rubber meets the road, and walking people through, because we know that real health, total health, if I would say it like that, or holistic health is 10 dimensional. It's not just the physical body. Of
Right.
course, it's that mental, the spiritual aspect, emotional. We went through all kinds of stuff: social, the intellectual, occupational, financial, environmental. And as I'm listening to you hearing and sharing all of these, the 10th dimension is, of course, medical, right? And we try not to get there. But if we have to be there, we're grateful for places like Jesse Trice and we're holistic, whether it's inpatient, outpatient, long term, and right here in the community. It's awesome. As we're sharing on this afternoon, and we're thinking about healthcare disparities, if you had to just break it down to say really why that's important, what would you share with those who are listening?
Sure, it's important because it affects not only our longevity, it impacts the community, it impacts the burden of disease that it may have on society. Hospital costs rise. And then there's also the productivity issue. We have a loss of productivity when we do not address health inequities.
Absolutely. And it's so important. And again, we're grateful for the work of Live Healthy Miami Gardens, Jesse Trice, and others who are out and championing health and the disparities and those barriers that, challenge us. And so when we anything that you've noticed in equity around mental health.
Yes, mental health is a big one. One in five persons is has a mental health issue. That even includes our children. So often, especially for minorities, we often will not access mental health services. because of stigma, and again, all of the other health disparities like the lack of insurance and things like that. However, I do want to say that the mental health component is as important. As you mentioned, it's just as important as the physical component. You actually cannot have one without the other.
And that's huge. And I think when we're talking about mental health, we're not just talking about those that have been diagnosed, right? And we know mental health is a lifelong journey. You can have part of your life where we're all good, and there can be some kind of catastrophe such as COVID. And in COVID we lost so many of our loved ones, and so grief and loss, all of those things are
Yes.
compounded. So I think it challenged all of us to look at our mental wellness, along the way. And so again, I'm so glad that you shared that. Are there specific things that Jesse Trice might be doing around, whether it's mental health or
Mhm.
any specific areas that you want to highlight for us this afternoon?
Yes, we have a whole mental health team. So we have social workers, we have psychiatrists on board, along with our case managers. And they're there for whatever your need may be. It doesn't have to be COVID related. We all go through some type of social or emotional problem at some points in our lives, some more so than others, but we all do. And that's just, it's a normal part of life. And it's completely normal, to want to talk to someone about those issues and have them taken care of. I think we always have a stigma that you may end up on medications, or you may end up being labeled inappropriately, and it's not the case. We're there just for talking. If you do need medications, that's there as well.
That's really good to know. And as I think about some of my working with individuals in the community and referring them out, because that's one of the things,
Mhm.
I believe in being a connector in the community to help to provide the resources. So with the mental health, is it insurance based, or how, how are there anything that would deter a person from accessing it, Jesse Trice in Miami
No,
Gardens?
there is nothing that should stop anyone from coming to Jesse Trice to receive any service. We do not turn anyone away. Yes, we do accept insurance, we accept pay out of pocket. We also offer a sliding ski fell, which is based upon you paying based upon your income. However, sometimes persons just don't have that. We will not turn a person away because of inability to pay.
That is awesome. That already answers my next question, because it was going to be what does Jesse Trice do to affect the disparities or any inequities? And you kind of shared that, and access is truly key, but not just the access. And we're so grateful, Dr. Lawrence. We know that you are busy, but coming on here to let people, or those that will listen either now in this space or later, be aware. Sometimes we have stuff right in our own backyard and we're not aware. And Jesse Trice is one of those. I'm not going to say a best kept secret. And if it's a secret to you, it's no longer. We need to make sure that we know just how important Jesse Trice is to our community in Miami Gardens. And then I think
Yes,
you have abroad.
we don't want it to be a secret by any means. We do not want it to be a secret. And I do want to also point out a couple of other things. We have a presence within 40 schools within Miami-Dade County. So if you have children there and you know that they need vaccines or whatever it is that they need, you can talk to your school nurse. We will make sure that your child gets it. And sometimes there's a way to deliver that care without the child having to leave school to come out to one of our clinical sites. So just reach out. We offer mental health services within the schools as well. The other thing I want to point out is that we will be deploying a mobile unit very soon out into the community. And with that mobile unit, we do intend to make home visits. So there's no reason why a person should not be able to access any service that Jesse Trice has to offer.
And that's powerful. And even as you were sharing, Dr. Lawrence, and I'm very serious about this, even as a resident of Miami Gardens, and also one who really wants to see people be healed, and in a holistic way. When I say secrets, sometimes there's stuff that we really don't know, and it does not matter whether you're an impacted person or even if you're a medical professional. And that's one of the things I love about Live Healthy Miami Gardens, and the beautiful time that I've had things, to hear about the resources. And so again, I'm so grateful, Dr. Lawrence. I know that there is somebody that's going to hear this to say, wow, I didn't know that, but guess what? They know it now, and we want to spread the word to Lottie Dottie and everybody about those resources that's there. I do have one other, and I know that we've been challenged with technical difficulties with our weather on the outside, even those who are text messaging, even as we're speaking, and we're grateful for this time. And so, as we're winding our time together down, if there was something we called it Ivy Tower nursing, like if you had the best world and all of the resources to fix healthcare disparities, or the minorities face, what would that be, or how would you do it?
It's just everybody coming together to work towards a common goal. It can't be done by any one individual. It takes not only the provider, but the support staff for that provider. It takes the social worker, it takes the psychiatrist, it takes the dentist, the optometrist, it takes all of those people delivering the care. And it also takes the community, it takes the individual. They all have to be involved.
And that is so important. We are better together. I know the theme is better health through better understanding, but yes, better understanding. But you're right. We're better together. And as a healthcare system, and as we go through one of the biggest healthcare crisis that we probably would see in our time, hopefully it's the biggest we'd see. The collaborative work of the acute settings, the long term, the community centers, and then just those practitioners who are out, and all of the disciplines. I like that you highlighted that. All of the disciplines are all important. And when we're coming together, we are better together, and we're able to address those outcomes. And so we're so absolutely grateful for you taking time out of your schedule today. I do want to see if there's anything else or any other nuggets that you might want to leave with those that are listening. We'll lend for you to do that now.
And sure, I charge everyone to just take responsibility for your health, seek out all of the services that you know you need, that you deserve. Don't let anything stop you from getting those services. No type of inequity or the disparities that cause those inequities. Just seek out the care that you need. Be persistent, and I assure you, especially if you come to Jesse Trice, we will help you.
And I'm so grateful for that. Dr. Lawrence, just one other thing. Before the name was Jesse Trice, was it not something else?
Economic opportunity.
Okay. Okay. And so to let you know how, I'm not going to tell my age, how old it was, North Dade Health
Health
Center.
center.
Yeah. And I share that as a testimony that it's living in our community. And we know we can go through changes. We go through administrations, and we get better and better and better. And so we're grateful. But I do remember, accessing even myself at times when I need it. So it doesn't matter where you are in your journey. Being able to have places like Jesse Trice is truly, truly a blessing. And we want to make sure that we take advantage of all of those resources. I heard you talk about dentistry. I was a
Yes.
dental assistant before a nurse for 10 years. And so I love,
Very good.
love it holistically, being able to tap into those resources. Again, our general health. Is there any other specialty that you want to highlight? I heard dentistry, of course, general health. We heard mental health. Is there any other?
Sure, Jesse Trice, we have optometry. We have a nutritionist on board. We also offer podiatry services as well. We have a full service lab. You can't go wrong. And we offer transportation.
Listen, you see that? All of those, removing barriers to get good health care, the right health care, as we're focusing. And so we're grateful. We're grateful. I did kind of look to try to see if we had any questions from those who might be online. And again, I do know we had a few challenges, but we did our best to share just some highlights and nuggets around health, equity, health inequity, and health disparities. and what Jesse Trice, Dr. Lawrence, and their amazing team, as well as our Live Healthy Miami Gardens teams and partners do to make a difference. And so with that said, Dr. Lawrence, I'm just grateful for the day, and there's nothing else that I want to add if you want to, and we're going to close out our amazing segment on today if there's not anything you want to add.
No, just thank you for having me. If you need to reach me, everyone can find me right there at Jesse Trace.
And for those who are watching, we had it run through the screen, and that information was there. And again, I'm grateful, Dr. Cheryl Coleman with Abundant Living Health and Wellness Resulting Services, one of Live Healthy Miami Gardens partners. And so you'll see us, we're in the community, we're working to make a difference for those we get to serve and the ones that we live, work, and play with. Live Healthy Miami Gardens, we're signing off for this week. Have an amazing day.
Thank you.